2019. So I wanted to use this exciting opportunity to bring to the Minister's attention the impact on the local community of pharmacy closures in the Hampton area in my constituency, as well as the immense financial challenges facing community pharmacy right across England, and raise concerns about the impenetrable bureaucratic processes surrounding new pharmacy licence applications, as well as closures, which I believe need overhauling. Now, to set the scene, Madam Deputy Speaker, last autumn, 2 Boots pharmacies in the Hampton area were closed. One of these pharmacies was in the ward of Hampton North, which is one of 3 wards of relative deprivation in the London Borough of Richmond upon Thames. The west of the ward is within the 20% most deprived areas of the country. It's densely populated with a significant amount of social housing. As a result of this particular closure in Tangley Park, the entire ward is now without a community pharmacy. Hampton North is poorly served by public transport, no station, and 2 bus routes that serve the area are notoriously unreliable. The nearest pharmacy is now a mile away on foot, a distance which is difficult to cover for the elderly and those with mobility issues. Certainly more than a 20-minute walk, the measure that previous ministers like to use to highlight pharmacy accessibility. Predictably, these closures have put a lot of pressure on the nearest remaining pharmacies with queues and stock issues. Again, not exactly convenient or practical for elderly and vulnerable patients. At this point, I'd like to pay tribute to Mike Derry and Healthwatch Richmond for their brilliant work championing local patients and giving them a voice. Healthwatch undertook a survey of some 700 residents in the Hampton area at the start of this year to demonstrate the impact of the closures. One person said, "I've gone without medication as I can't stand very long. There are queues, I've waited over half an hour." Healthwatch England highlighted the plight of 87-year-old Jill. She used to just about be able to get across the road from her house to the Tangley Park pharmacy. Now the nearest branch is over a mile away, and Jill, who doesn't drive, can't access this service due to the distance she'd have to walk to get there. She even paid the nearest pharmacy to deliver her medicines to her home each month. However, in the 8 months since she purchased this delivery service, they've only shown up twice. Her carer has to travel to collect the medication in person for her. Now, Hampton is not unusual in losing pharmacy provision. I'm sure the Minister is aware of the crisis facing the community pharmacy sector. Data from the Community Chemists Association shows that since 2015 there has been a net loss of over 1,200 pharmacies. And that's 1,402 closures and only 179 openings. More than a third of these have been in the most deprived areas of the country. The National Pharmacy Association report that the number of pharmacies closing so far this calendar year is nearly 50% higher compared to the same point in the year in 2023, with the equivalent of 10 pharmacies a week shutting their doors. As well as independent pharmacies, big chains such as Lloyd's and Boots have significantly accelerated these closure numbers over the past 18 months. Now, a big driver of these closures is a significant real terms reduction in funding for pharmacy, which has dropped by around 30% since 2015.
Will my honourable friend give way?
I'd be delighted to give way.
Thank you very much. I was just going to ask my honourable friend if she is aware of the issue of overwhelmed doctor's surgeries, referring increasing number of patients to pharmacists in local areas. I've seen it myself in my constituency of Lewis. And does she agree that this will only contribute further to closures?
I thank my honourable friend for his intervention and his excellent maiden speech earlier. I completely agree with him. And actually, we want doctors to be using community pharmacy more to alleviate pressure on other parts of the health service. But frankly, if the pharmacies aren't there, the remaining ones are getting overwhelmed. And certainly talking to local doctors, local GPs in the Hampton area following these closures, they were desperate to see more provision. They thought about trying to set up their own community pharmacy provision, but they just couldn't make the numbers add up. And that's because of this funding shortfall that I was just talking about. The Community Chemists Association estimate an average funding shortfall of £67,000 per pharmacy based on an analysis of data published by the Department of Health and Social Care in a written parliamentary answer at the beginning of last year. Many pharmacists are being left out of pocket, reimbursed less for a number of medications compared to the price they're paying, with stories of some using credit cards and overdrafts to purchase medication. These funding pressures are coupled with major workforce challenges. Indeed, when I met with Boots following the news that they were closing 2 branches in Hampton, they cited lack of pharmacists as a major reason why they were closing some 300 pharmacies across the UK, though clearly commercial pressures were the main driver. And layered on top of these issues are regular medicine supply shortages, which add more work and stress to already overstretched pharmacists. Community Pharmacy England reported last year that 92% of pharmacies were having to manage supply issues daily. Madam Deputy Speaker, it is a perfect storm for community pharmacy at a time when we need preventative healthcare and self-care more than ever. The potential of community pharmacies to improve patient health and reduce the pressure on NHS hospitals and GPs is immense, yet they are closing in their hundreds every year. We should be relying on pharmacies even more to keep the nation healthy, and whilst the previous Conservative government's announcement of the Pharmacy First initiative was very welcome in terms of its ambition, if pharmacies are not even funded for the basics right now, and with big gaps in provision opening up all over the country, it's hard to see how those Pharmacy First ambitions will be achieved. And in fact, Liberal Democrats would like to see the government building on the Pharmacy First principle to give pharmacists more prescribing rights and public health responsibilities. Like so many areas of public health, the Invest to Save argument is compelling, and I look forward to hearing the Minister's comments on what the new Labour government will do in terms of funding to enable community pharmacy not just to survive, but to thrive and grow as an essential part of our primary care infrastructure. Now, having addressed the causes of these closures, Madam Deputy Speaker, I want to spend some time exploring the processes involved in local communities being informed of pharmacy closures and their input, or lack thereof, as well as the complete lack of transparency or accountability in relation to applications for new pharmacy licences. For starters, only those organisations designated as interested parties in the regulations are informed of new applications, and only their feedback has to be taken into account. Anyone else interested, such as me as a local MP, needs to make a freedom of information request unless somebody in the local health community passes on the information to me. And my views and other people's views in the community can be ignored. Now, to describe the bureaucratic process that sits around new applications as Byzantine would be generous. I hope the Minister and Madam Deputy Speaker and other honourable members will bear with me whilst I try to explain what happened in Hampton, where we are part of the South West London Integrated Care Board. However, NHS England has delegated the pharmacy market entry function for the whole of London to North East London ICB, completely the opposite side of the city, where officials have no local knowledge of our area or understanding of local transport links or relationships with the local health system. So starting with the closures, the Minister will be aware of the statutory 3-month notice period for pharmacy closures that Boots would have had to give NHS England last August regarding its intentions in Hampton. This information was not passed by NHSE to Richmond Health and Wellbeing Board. I find this utterly staggering. The first that local councillors, I as the MP, and the local health community in the area knew about the planned closures was when Boots placed signs in their windows to inform customers. Concerned constituents started to contact me and local councillors regarding the likely impact of the closures. Now, at exactly the same time as this was going on and we were all in the dark, at the end of August 2023, the local Health and Wellbeing Board published a pharmaceutical needs assessment, but this was inaccurate and failed to identify an imminent future gap in need in the Hampton North area because they had not been notified of these closures. So the Tangley Park Boots subsequently closed in late October, and the Priory Road Boots directly opposite a busy GP surgery closed in early November. Now, in November, an application was received for a new independent pharmacy licence on the Tangley Park Boots site. Once again, the local Health and Wellbeing Board was not notified of this application, this time for 2 whole months. Now, during this period of complete silence, the Health and Wellbeing Board issued a supplementary statement to the local pharmaceutical needs assessment which identified the gap in Hampton. However, because the application for a new pharmacy was made in November referencing the original needs assessment before the supplementary statement was published, even though the application itself identified the gap that the supplementary statement subsequently published in December officially made clear, it was rejected. Not only that, it took the North East London ICB a full 8 months to issue that rejection. It was only issued earlier this month, despite the decision the decision using evidence received in December to justify its rejection. Now, Madam Deputy Speaker, if you and other honourable members are still managing to follow this sorry story, I hope you will agree with me that this decision is utterly perverse, and it is also utterly unreasonable that timely applications to open pharmacies in response to multiple closures should be inherently prevented in this way. The delays in sharing information with the local Health and Wellbeing Board and the delays in decision-making are unforgivable. During that lengthy delay, the local authority received a planning application to change the Tangley Park pharmacy site into a fast food outlet. Thankfully, it was rejected earlier this month after representations from the public health team and councillors. But I'm sure the Public Health Minister would agree with me that it would be unfortunate, to put it mildly, if a pharmacy had been replaced with a fast food outlet. Now, one local official told me yesterday that the system architecture is too complicated and there is a need for clearer responsibilities and accountability. Amen to that, I say. Healthwatch Richmond has demanded answers from the North East London ICB, and frankly, they've received a woeful response that does not address the substantive question of why this application was so badly handled. The response passes the buck and it blames regulations. So to be clear, Madam Deputy Speaker, neither I nor Healthwatch are qualified to comment on the merits of a specific application. What we are doing is we are challenging the unfathomable process. So I say to the Minister, the huge funding challenges facing community pharmacy are pressing, and I appreciate that they may be extremely difficult for him to address given the iron fist of the Chancellor as far as any additional public spending is concerned. Yet he must wage a campaign to improve the funding situation. It makes financial sense, and we are not going to grow the economy without improving the nation's health. He will have cross-party support from these benches in doing so. But revisiting the regulations and how they are being implemented by NHS England will cost next to nothing. There should be proper consultation and involvement of the local community on closure notices, and changes in processes for new licences could ensure that we are quickly able to plug pharmacy gaps where they open up in areas such as Hampton. And crucially, those powers need to be delegated to the local ICB with full involvement from the local Health and Wellbeing Board. They know their communities and their geography best. Trust them. Finally, if the Minister is able to step in on the specific issues we are facing in my constituency, the application that's been rejected and going to appeal with NHS resolution, simply to ensure that we have a common sense approach, the residents of Hampton North and I would be very grateful. We desperately need a new pharmacy for our community, and I look forward to his response.
Minister.
Thank you, Madam Deputy Speaker, and can I start by welcoming you to the Chair and congratulate you on your election earlier this week. I also want to congratulate the Honourable Member for Twickenham on securing what is an absolutely crucial debate, not just for the specifics of the case in her constituency, but for the precedent that then sets as we plan community pharmacy around England. I also want to assure her that, having missed out on his week in London for Whit half term because somebody called a general election, Lyle is already on his way down to London as I speak with Alison so we can do London as tourists this weekend. Madam Deputy Speaker, I'm responding on behalf of my honourable friend, the member for Aberfan Maesteg, who leads on this area, but I want to start by paying tribute to pharmacists. It's a credit to them that surveys show that 9 in 10 people who visit pharmacies feel positive about their experience. Colleagues appreciate how accessible pharmacies in towns and villages across our country are. But for too long, governments have failed to recognise their essential role in safeguarding the nation's health, not least in my own constituency of Gorton and Denton. This government knows people who work in pharmacies are highly trained specialists, and we are committed to helping pharmacists and pharmacy technicians reach their full potential. They already provide vital advice on prescriptions, over-the-counter medicines and on minor ailments. But pharmacies don't just dispense medicines and proffer advice, important though that is. They must do much more than that. Many already offer blood pressure checks, flu and COVID-19 vaccinations, contraception consultations, and treatment for the 7 conditions covered by the Pharmacy First service. I supported Pharmacy First from opposition, and I think as did the Honourable Lady, and we pledged to build on the programme by making prescribing an integral part of the services delivered by community pharmacies. So within the next 2 years, we will ensure that every newly qualified pharmacist has a prescribing qualification while we train up the existing workforce. This year, NHS England is working closely with all integrated care boards on pilots to test how prescribing can work in community pharmacy, because we want, and I believe she does too, pharmacies delivering services that help patients access advice, prevention and treatment more easily. Services that ease some of the pressure of general practice and other areas in the NHS, and services that unlock the knowledge and expertise that our pharmacists already have to offer. This government takes the view that pharmacies can and should play an even greater role in providing healthcare on the high street. And that is why we stood on a manifesto to shift resources to primary care and to community services over time. And community pharmacies will play an important part in moving our health service from hospital to community, from analogue to digital, and from sickness to prevention. But we've only been in office for 3 weeks. It can't happen overnight. And that's why, until then, colleagues have been absolutely right to raise concerns to ministers about the closure of pharmacies. As we speak, well over 10,000 pharmacies in England are dispensing medicines, offering advice and delivering care. And despite closures, access to pharmacies across most of the country remains good. 4 out of 5 people live within a 20-minute walk from their local pharmacy. But as we've heard in this really important debate, that isn't the same across the country. And I know, having listened to the Honourable Lady, in Twickenham it is higher than 4 in 5, but in other parts of the country it is below 1 in 2. And the most deprived parts of England are almost, there are almost twice as many pharmacies, which is a good thing, than in the least deprived, but we need better access across the country. To take the example of my own constituency, access to pharmacies is fairly good. Almost the entire population is within a 20-minute walk from a pharmacy. But in certain rural areas and in a growing number of urban areas because of the closure programme, that isn't the case. But in those rural areas, there are dispensing doctors who can supply medicines to patients, and patients across the country can access around 400 distance-selling pharmacies that deliver medicines to patients' homes free of charge. So it is true that experiences vary depending on where people live. But if I can just finish the sentence, then I'll give way. But I am aware of the specific problem in Hampton following the closure of the 2 Boots pharmacies that she has already described, and I will happily give way to her on that point.
I thank the Minister for giving way. Just on that point about the 20-minute walk and the 4 and 5 statistic, does he recognise that a 20-minute walk for me or him is actually much longer for an elderly person or somebody with multiple health conditions and mobility issues? So that we've got to work out what measure it is that we're using. And yes, Twickenham as a constituency may have many pharmacies, but we've got to look at that really highly localised level, which is why we need the local authority and local health boards to be involved, because actually Hampton as a community, the transport links are terrible.
No, I completely understand the case that the Honourable Lady is making, and please understand that she is pushing on a bit of an open door here. It's a completely different subject, but I've had exactly the same arguments about bank closures in my constituency, where I'm told that as long as the nearest bank branch is half an hour away by public transport, that is acceptable. Unfortunately, computer says no when it's 2 buses that don't meet up in between, and so there are, I agree with her, complexities around when you draw up these arbitrary limits, but generally access to pharmacy is good, and we need to be maximising the use of that pharmacy network so we get more pharmacists coming in. I'll give way.
Thank you to the Honourable Member for giving way. I welcome the government's support for strengthening the pharmacy sector, and you talked about the workforce. I have residents in my constituency of Mid Sussex that have raised concerns about the pressure that is being put on pharmacists to take more and more services on that might traditionally have been provided by primary care. What assurances can you give me that you'll make sure that the workforce plan for pharmacists is robust enough to cope with that extra demand?
So we are very committed, as the Honourable Lady, I hope, knows, to having that workforce plan as robust as it can be, so that we don't just get the pharmacists of the future, but the doctors, the nurses, the healthcare workers and so on, so that on that journey to a national health service that is much more community focused, that is much more aligned to prevention, rather than to curing sickness. We want to prevent people from becoming ill in the first place. We have to make sure that at the heart of that is how we can deliver medicines and treatments closer to where people live, and having well-trained capabilities in the pharmacy sector to do that is very much a priority for this government. Madam Deputy Speaker, returning to the issue of the 2 Boots closures in Hampton, I know my honourable friend, the member for Aberfan Maesteg, is aware of these closures as well, and he has promised to me and to communicate to her that he will be keeping a very close eye on what is happening on the ground in her area. On the Honourable Lady's specific point about bureaucracy, I can assure her the regulatory framework is always under review, and we are keen as a new government to make improvements wherever we can, and I'm sure my officials will have heard the case that she has made today. After the Honourable Lady kindly reached out to me prior to this debate, I instructed officials to ask her ICB to consider her concerns again. I hear that she's had a reply that wasn't particularly helpful, and again I hope that her ICB is watching this debate, is listening to the case that she has made, and is listening to me as the Minister from the dispatch box to say that these are issues we take seriously. Good access to pharmacy services is important to her constituents, and it is important to constituents of members from right across the House, and we need to make sure that that network is protected and is enhanced. On funding, I want to tell the House that NHS England has commissioned an economic analysis of the cost of providing pharmaceutical services. That work is happening right now as we speak with the pharmacy sector, and we look forward to seeing the outcome. Previous governments dithered and delayed on finding a sustainable and long-term solution, and the consultation around this year's funding and contractual arrangements with Community Pharmacy England did not make it over the line before the election was called. So we are looking at that as ministers as a matter of urgency. All that we speak of today, though, is against the backdrop of the most challenging circumstances since the Second World War. That's why the Chancellor is carrying out an urgent assessment of our spending inheritance and will be presenting the results to Parliament before the summer recess, so that the findings can inform every spending decision we make. In the meantime, I'm afraid I can't update the House on this year's arrangements, and I understand that this will be frustrating to the Honourable Lady, but the Prime Minister has asked me and every minister of this government to be honest and open about the state of the nation's finances. I intend to keep that promise, but I do look forward to working with pharmacy stakeholders, not just to discuss how we solve these problems, but how we seize the opportunities in the sector to transform how we deliver health and social care in the community, closer to where people need it, and providing those new innovative treatments from the pharmacies themselves where that is appropriate. This government will always put patients before politics, and in the spirit of the friendship that we have developed over the years, particularly over the kinship issue, I certainly look forward to working with the Honourable Lady on this issue, on other health-related issues, and on making our country a better, fairer, more equal place for her constituents and mine, with better access to health services, including community pharmacy. And I hope to work with the Honourable Lady in the years to come, and let's hope we can improve pharmacy services for Hampton and for other parts of England.